All right. Good morning, Dr. George. Thank you so much. Thank you, team, for joining us. I will tell you, we're excited to bring this information to you, but absolutely more excited to hear from you. We have several breakout rooms, so certainly we're going to be able to answer your questions. You'll talk to an array of subject matter experts to help walk through those questions or issues that you may be having. But, you know, the Exceptional Family Member Program came about in the late 70s, actually. So it's been around a while, but the bottom line is we have not been able to really grasp how to best help our families. Our EFMP families need that support in order to be mission ready. We are here to do that. We are very dedicated and committed to doing that.
Recording in progress.
And I'll tell you, certainly you joining us today is a reminder to us that this information is super important to our families and to our stakeholders. But more importantly, we just want to connect, right? Knowing what you're going through, knowing the gaps in service, knowing what's working well, those are all things that propel us every single day. So we are excited to walk through some things with you. Today's session is really just talking about the program itself. And this isn't the only one we have planned, right? So our community forums, we plan to do these every month, which is really exciting. Again, it just gives us an opportunity to connect with you, to let you know what's going on within the program today and tomorrow. You'll see on the screen here, you'll see on the screen that coming up some future topics, we're going to talk about behavioral healthcare culture, behavioral healthcare, mental health care, both of those certainly in high demand right now across our nation, right? And so here within the walls of the Department of the Air Force, our families too are needing this care. And so we want to chat about the culture of behavioral and mental health care, how to access it, how to really walk through that journey, right, of establishing this care for your families and reestablishing it as UPCS. Cultures are very different across, right, the United States and the different countries that we reassign families to, so we definitely want to delve into that. We're also going to have a session on autism support. Autism is the #2 reason why families are enrolled into EFMP. So again, a definite topic that we'd love to spend some more time with our families who are garnering autism support or trying to garner that autism support. So we look forward to that. And then finally, we'll be establishing a program for our EFMP families. And this is a champion program where we'll have ambassadors and mentors from different EFMP locations to help families as we journey through this together. So again, just that outreach and that outpouring of family support, we look forward to bringing all of these to you in the future. So stay tuned, and however you found out about today's session, know that we will be advertising for these future sessions. Definitely your feedback is the center of all that we do. It has been the center of the past 3 years of all the transformation efforts, but truly we can't do it without you. So again, we're glad you're logged in, and we look forward to, I'll share some information first, and then we'll get into our breakout groups, and that's where those real conversations can happen. So we are definitely happy to host all of you. Okay, so today we're going to talk a little bit about EFMP, past, present, and future. EFMP is congressionally mandated. We'll talk about that. But most important, I want to talk about how EFMP impacts readiness and how your readiness as a family is super important to our Air Force. It's super important to our nation and to our Air Force. So we'll talk through that a bit. We're also going to talk about how to access support and connecting with your local resources. Okay, so EFMP is steeped in law, right? So as I said, this came about in the late 70s, and I will tell you, it has grown tremendously. The advocacy that families have really worked hard to show Congress, to show our nation, to show our departmental leaders the need to ensure that family care is a big part of the business that we do. And so I'll tell you the law, U.S. Title 10, Section 1781C is where you can find the premise for the EFMP program through the Office of Special Needs, which is the DoD level office that oversees this program. Certainly, what is super important, the takeaway from Title 10 is certainly that each department is charged to provide an EFMP program and to send service members to assignments where care and support for family members with special needs are available, right? So why do we check to make sure that we can care for a family at the next location we're sending them? It's because it's important to all of us, right? And in the law, it states that we're only going to send families where we know, where we have deemed that care is available for that family. The Dodi, the DODI 131518 military assignments gives us a little more guidance. In this particular guidance is where it really draws attention to the fact that decisions will not be influenced by the employment, school enrollment, or health of a service member's family member, right? So in the normal assignment process, right, our military members, they will compete in their own right for assignments, and then we post-screen the family to ensure that that family care is available at the gaining location. The exception, of course, is when the military member comes forth with a personal hardship. The best example of that is when maybe a family is stationed at a location. Let's take Laughlin Air Force Base, Texas, right? Laughlin, you have a family stationed there and a new diagnosis comes about for a family member, and Laughlin's local community or their MTF cannot care for that family member, then of course that's a hardship, right? We need to move that family out of that location so we can put them at a location where care is available. So that's the exception for that. 131519, another DODI. This one is specific to the Exceptional Family Member Program. And here the point I want to make with all of you certainly is that we want to ensure that folks are enrolled into EFMP that meet the criteria, right? Because again, the only way I can ensure if care is available at the next location I'm sending you is to know that those conditions exist and then that family needs that screening, right? So certainly the EFMP DODI really allows or really explains how important enrollment is and how we as services must send you to a location where that care is available. We will not deny you consideration because you have an EFMP family member, right? That steeps back into the assignment DODI as well. That has no bearing on your selection for a particular assignment. The Q code is not considered. So the Q code, for those of you who may not know, EFMP enrollment, basically how we know that your family is EFMP enrolled is there's a Q, the letter Q is a code that we put into the military personnel data system, which helps us just identify that this family is an EFMP enrolled family. That Q code is not seen through any of the formal assignment selection process. So certainly that is how we ensure that that we have that fair and equitable assignment selection. And we do not consider the fact that your family is enrolled in EFMP when we're selecting you for an assignment. The travel screening occurs after the formal assignment selection. And of course, this point in time clearance certainly ensures that the gaining location can provide any required medical or educational specialty services. And point in time is super important, right? Things change in our lives, right? Things change in our conditions. Things change in medical care availability at the gaining location, right? Doctors, PCS in and PCS out. Providers come into the TRICARE network, leave the TRICARE network, right? So point in time is really significant here. So at the time that an assignment happens, there are so many things that we're going to consider, and I'll show you a slide that really depicts that. But there's a lot of things we're looking at, right, to make sure that when we send you that continuity of care, you get the best opportunity for that for your family members. When family travel is disapproved, and ladies and gentlemen, that happens about 10% of the time, family members the care is deemed not available for them at the gaining location, and therefore, of course, we will cancel that assignment because we definitely don't want to send the family where care is not available. Or if you're in a mandatory move status, maybe you're overseas and you're returning back to the CONUS, then of course we're going to divert you to a location to where we have deemed that care is available. All right, so definitely some governance. There's lots of guidance out there, right? Lots of governance, lots of things for us to follow to make sure that we take care of our families. Now, I'll tell you, there's some facts and there's some myths about EFMP, right? Certainly some of the myths you'll be able to talk through in your particular breakout groups, but I definitely wanted to present some of the major facts about this particular program. So certainly it exists to care for families who have exceptional needs, whether that's education or medical needs. We have seen steady program growth over the last 15 years. You can see here the numbers. Certainly in 2009, we had about 16,000 families enrolled. Today, we have about 36,000, right? So certainly lots of growth. Truly, I think one of the big ones that really caused or led us to a higher enrollment rate was when they added asthma as one of the conditions that certainly impacted many families in our force. And so that was one of the reasons why we've really grown. But please know that the DoD, the Department of Defense, is always looking at what's happening across the medical community, the educational community, and the things that we need to consider for enrollment. Because again, if you need specialty care, right? If a member of your family needs that specialty care, we need it documented so like that we can ensure that we're sending you to a location where that specialty care can continue. We talked about how it's congressionally mandated. There's no opt-in or opt-out of EFMP, right? If you're assessed and you meet the criteria of EFMP enrollment, which is on the right side of your screen, then you are enrolled into the program. We use PCS travel screening as one of the ways to look for those who should be enrolled. And take, for example, many of us sit at a location, right? Maybe 3 or 4 years. Things happen during that 3 or 4 years, right? Our family members are getting care. Maybe we start to see a specialist, but somehow that doesn't get back to the EFMP office at the MTF. We see off-base doctors, right? Many times off-base physicians are specialists. They're the ones caring for our family members, and they don't always know to go back and tell the Air Force that, oh, I'm going to see this patient now monthly for specialty care, which, as you can see on the right side of the screen, that meets the criteria for EFMP enrollment. So certainly PCS time, right? When we're about to move a family, that's the time when we do that double check, right? If this family's not enrolled, should they be enrolled? And that's particularly important for overseas, right? When you're moving CONUS to CONUS, certainly some rural bases may have issues with limited services, but going overseas, the DODI requires us to screen every family member going to an overseas location, regardless of their EFMP status. Again, we're going to do that check to make sure, do they have any specialty needs? Are they enrolled in the EFMP? And if they're not, do we need to enroll them? But we need to make sure that that family can be cleared to go to the overseas location, because we're going to ask them to spend 3 or 4 years at that overseas location. Have to make sure that that care is available. And then again, when that EFMP reassignment option needs to come about, in other words, I'm at a location where care cannot be provided for my dependent, then I can ask for a reassignment to get to a location that specifically can. Again, on the right side, I talked a little bit about these conditions. This is strictly written in the DODI and that Department of Defense instruction. These are the things that we assess family members for EFMP enrollment. So anyone seeing a specialist, a healthcare specialist more than once a year is going to be assessed for enrollment. Any of your dependents who may have asthma, if they're hospitalized for the same condition more than once over the last 5 years, certainly is going to be assessed for EFMP enrollment. Any use of a medical assistance device, and then of course for education, if a child's been recommended for an individual education plan or early intervention services, right? Maybe there is a developmental delay in a very young child, 0 to 3 years old. These are all things that are assessed for EFMP enrollment. A physician makes the decision as to whether a family is enrolled in EFMP. So once that medical review officer makes that decision, right, the special needs coordinator, which is your base level POC for all things medical EFMP, they will enroll the family, of course, contact you as with notification, and then get you over to the family support coordinator so you can now learn what the EFMP program is about, what services are available, what resources we can offer, and how we can help your family. Certainly EFMP is required. That support is required to make sure the mission gets done right. A mission-ready airman our guardian certainly has a mission-ready family, right? And the best way to make sure that that family is mission-ready is to make sure that that support is there for them. Our families deserve the best care we can give them, and we certainly want to make sure that that is available as we transition families from location to location. There have been some long-standing challenges within the program. I alluded that a little bit earlier. Certainly, the program's been around a while. Incrementally, we've made some changes. Incrementally, we've improved service. But in 2019, our families were very honest as they stood beside us in front of Congress and expressed their concern over many gaps in the support of EFMP, basically the support that they were not getting. And so this led us to a clear path of making a difference, of really assessing where we were in program support to our EFMP families and what we needed to do to make it better. Families are great advocates. Their testimonies carry a strong support. They tell a great story of the struggle, of the challenges, and really allowed us as Air Force program leaders to bring about some significant change. You'll see some of those challenges. I think probably if you're an EFMP family logged in, you can probably look at about 3 of these and go, yep, been there, done that. I've experienced that, and I'm ready for that to change too. The past 3 years, we have really worked hard on those first couple. So travel decisions, paperwork requirements, right? PCSing is hard enough, right? There is a to-do list a mile long. And for EFMP families, it became 2 miles long, right? All the extra things that we had to do to prepare our families to move to the next location. So that was something we really, really focused on. Specialized legal assistance for our families who have educational needs, and they were fighting school districts trying to establish that comparable care that their children maybe had received at the last school district that this school district was not willing to provide. So again, great testimonies and a great path forward, a roadmap per se for our Air Force to really make a difference. And we did, right? The congressional hearings happened in late 2019, in early 2020. The Air Force took some significant steps to improve this program. Looking at that list of longstanding challenges, these were the things that the Air Force said, you know what, these are the things we need to do first, right? The first thing is we have got to centralize EFMP. We need one owner of EFMP. Again, lots of different programs existed for many years, but they weren't working in tandem. They were working parallel to each other, and our families were confused, not knowing who to go to for what service. So what we really wanted to do was let's establish that one office, that one owner of EFMP, and your Air Force A1, Lieutenant General Caroline Miller, owns EFMP. She is an exceptional advocate, but her predecessor was the one who really put this into place. And so now here at the Personnel Center, I get the opportunity to lead the EFMP One Stop, the central cell, where we have medical assignments, family support, special education, and respite care partners all here in one office, helping to make the policy and procedures and training our base level stakeholders to provide that exceptional care to our families. We centralized that family member travel screening process. So again, I talked a little bit about, hey, before you PCS, especially those folks going overseas, we screen every family member to make sure that if there's any specialty care needs, that those needs can be provided to the family at the gaining location. And for some think, gosh, how hard can that really be, right? How hard can it be to get that care, right? What are all the things you're looking at and trying to provide us? And I'll tell you, I can't necessarily get to that slide, so give me just a second and I'm going to scroll down to get to it. So these are all the things that we hear in the central cell, right? When we centralized family member travel screening, looking at all the things that our family members need, the care that they're getting, and is that care available at the gaining location? These are the things we're looking at, right? Of course, diagnosis and prognosis, absolutely. That's the baseline of the care that the family is receiving. But we're also going to consider all of these other things, right? What's the medical history of those dependents? Is there a specialist available if they are getting that specialty care? What are the comorbidities? What are those other conditions that may come from the baseline diagnosis, right? What are the other things we may have to take care of as that family moves to that location? What's the juncture of care? Is the family stable, that family member receiving stable treatment, or did we just have maybe a new treatment start or a new medication begin, right? Certainly juncture of care is super important, as well as that continuity of care. Does that gaining location have a specialist who can provide that level of care that the member's receiving currently? We want to try very hard to have that continuity of care so the family member continues to get what they need. How far is it to care? How often are you bringing your family member to care, right? Those are, of course, basic and fundamental considerations. But there's also a multitude of other things, right? We talked about how we're going to screen everyone for overseas. What does that TRICARE provider network look like at the gaining location? What are the MTF, the military treatment facilities? What are their current capabilities within that facility? What specialists do they have? What type of openings or availability do they have? TRICARE providers come in and out of the network, right? That is normal business. So certainly looking not only in the MTF, but looking at the TRICARE availability around the base is certainly part of our consideration. Cultural healthcare differences, right? When you're moving overseas, something super important that we take into consideration is the cultural differences. Not everyone has the same level of care as Americans, right? And you'll see the American medical standards of care is on here because certainly we pride ourselves certainly in the healthcare that we provide to Americans, and certainly we want that level of care for our families who may be serving overseas. Medication availability and legality. There are certain medications that are actually illegal in other countries. So certainly a consideration here. Language and communication barriers. Many times if you're overseas in certain countries, you'll have to have a translator with you. That is okay for some conditions, but may be very detrimental to others, right? So certainly an important part of the things that we consider as we're looking to approve travel. And of course, special education, right? We work very closely with DODEA, the Department of Defense Educational Agency, as they will help us determine if special education services are available for any dependents who need those in the overseas area. So lots to consider, certainly a lot of considerations to ensure that the family is taken care of at that gaining location. So let me scroll back to okay, so centralized family member travel screening has made the process more consistent. I will tell you, we started out, if anyone PCS last year, certainly you were a part of our transition, and that transition was very difficult. Happy to report that certainly that things are much better this year, and we have a great grasp and can do those travel screenings very, very quickly. We automated everything. Wow, MyVector. For those of you who have PCS or will PCS soon, MyVector is the new electronic platform, the digital platform for all things family member travel and EFMP. We are still building MyVector, but certainly that has been an exceptional win for our families, right? When we talk about how our families were very distraught, right, by all the admin burden on them, right? We certainly knew that digitizing this process would be very beneficial. On the right side of your screen, you will see the best parts about automating means you don't have to start over with every PCS, right? Once you fill out your information within MyVector and PCS, right, it archives it, and then your next PCS, it's going to drop that information back in, and you just have to update whatever happened at that current location. So certainly a great means to help our families not be so administratively burdened with this process. You can track your status of your family member travel screening case through MyVector. Transparency, right? We want you to know where that application is and what's happening with it. Gives you an opportunity to interject, right, if it's sitting somewhere too long. We allow an appeal process, right? So if you are disapproved, if a family is disapproved for travel, there is a reconsideration process. If you have new information or information that you believe would help us come to a different conclusion, then we absolutely want to see that information and consider it. Assignment navigators are here now to help you if you're disapproved for travel. An assignment navigator steps alongside of you and talks about what's next, right? Do you want to do an appeal and ask for a reconsideration? Do we need to divert you to a different location? And they'll work with your assignment teams here at AFPC or the air staff to make that happen. So assignment navigators are always attached to our families to help them through finding out what's next for their family. The Family Vector website, what a great website. So DAF Family Vector is a great site of information and referrals for your family. So please check that out if you haven't. And then of course, we established special education legal assistance. Prior to 2020, there was no in-house special education legal assistance within the walls of the Department of the Air Force. We sent our families out to local advocates in the local community to receive that type of service. Well, in 2021, we hired an exceptional, no pun intended, special education attorney here within the Central Cell. And I will tell you, she has trained all of our base level legal assistance offices. And so as families run into any type of challenge with their local school district about providing care for their special education students, they can go over to the legal assistance office and ask for help. That legal assistance team will help with IEPs, the individual education plans. They will walk through that plan with the family, making sure that the school is adhering to the needs of that particular child. Our legal assistance attorneys are now well in the know of what those parent rights are, what the child rights are, right? And can help hold schools accountable. So again, families, if you are struggling with your school district, please call on the help of your local legal assistance office. They are, of course, as cases come through, we're building that expertise, but please know that they always have reached back to Ms. Aka here at the Personnel Center, our exceptional special education lawyer. So we look forward to hearing, right, that our families are utilizing this service. I will tell you, we've helped about 200 families thus far over the last 2 years, but as I travel, I hear of a lot of families who struggle in this area. So please, 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 as you talk with maybe some of your fellow EFMP families, if you yourself are struggling, please know that that care is available for you and your family. We're not done with transformation, right? We've done some really great foundational programmatic things, right? But boy, we are not done. We're going to go over a few of the initiatives that we have going, and then I want you to get into your breakout room so that you can ask those very specific questions that impact you and your family. But on the horizon, I tell you, the number one thing that we here at the Personnel Center and your Department of the Air Force leaders are fighting for is to build strong community partnerships. Right here within the Department of the Air Force, we are working very hard to make things better for our EFMP families, but certainly we can't do it alone. We need agencies like DHA, the Defense Health Agencies, to help us with the expansion of specialty healthcare at locations with high denial rates, right? We have some rural Air Force locations, right here in the United States. And because of their rural nature, local communities have a tough time supporting our medical specialty needs. So we need the department, the Defense Health Agency, to help us do that. We need TRICARE's help, right? We need that healthcare provider directory to be current. We need TRICARE to recruit providers in those, especially in those rural areas. We need to know why providers are leaving, right? Why do they leave the TRICARE network and then leave our families struggling to find another provider? So TRICARE is a huge partner and a great stakeholder. So we continue to advocate for those things for our families. We need the help of state and local governments, right? Our military bases certainly provide a great economic resource for our state and local governments, but we need their help because we need them to rally their communities around our Air Force bases and Space Force bases to help us partner and take care of our families. So super important to have that. Congressional leaders, right? Congress certainly, they truly listen to what our families need, and they're advocating on behalf of families. And certainly we need their support for legislation, for healthcare funding, and certainly, again, that civic support, right? Supporting military families is certainly something that our congressional leaders can really help build. Finally, we want to work with the Department of Education. Our families, as they seek care for special education needs, it is super important that our Department of Education is well tuned in what our military families are facing and how they can help us with expanding special education teachers and paraprofessionals, having that in the overseas locations as well, super important. So like that, our children can thrive regardless of where we're sending their military parent. We want to continue to enhance the EFMP customer experience. The MyVector platform right now has all things medical and assignments on the EFMP realm, but we need to build in that family support. So that's coming this summer, and we will have all the pillars of the EFMP program in one system, which will allow us to communicate through those pillars and provide that comprehensive support to you all as family members. We want to integrate support at the installation level, right? That is where you live out EFMP, right? That is where those on location subject matter experts exist to help you navigate the different resources, the different programs that can best support your family. We really want to focus on GSUs, those geographically separated units. Not everyone is stationed at a military installation, right? We have airmen and guardians all over this great nation, and certainly we need to ensure that those who are not assigned to an actual installation get that same level of support. So certainly we have a strong focus on that right now. We need to measure customer satisfaction. I need to know where your true pain points are, right? So many times I'll get feedback that says EFMP was awful, our PCS move was awful, but I don't know in which areas that happened, right? Was it a housing issue? Was it a TMO issue? Was it a medical issue, trying to get reestablished into medical care? Was it educational? We had an issue with the school district, right? If I can really start to focus in on those particular issues, this team will provide those solutions, right? So together, right, the family and the Air Force coming together for those solutions. So certainly that is coming in the very near future, and we'll probably do a lot of that through the MyVector platform when we bring on that family support module. So definitely more to come on that. We also will establish an EFMP Champion Family Initiative. Again, this is where we'll ask families to help other families, right? There is no better person to understand your journey than someone who is on that journey right alongside of you. Certainly having those families at different installations around our Air Force will help to connect families, and that is certainly something that we know will certainly help and build that resilience of our EFMP families. And finally, we've got to communicate, right? Part of this community forum is to ensure that we're communicating with you and you get an opportunity to communicate with us. So lots of great things on the horizon. Please know that we are in tune with what's going on, but no better way to stay in tune than to actually get to talk to you. So we're going to go into our breakout rooms so like that we can really get to know what's on your mind. I am going to put on the screen a few things. The first thing is know your local resources, right? You have a lot of resources at the base. You have a special needs coordinator, which is in your military treatment facility that helps with that family member travel screening. You have your family support coordinator. What a great resource there on the base. Your family support coordinator is in the Military and Family Readiness Center, and they are your hub for all things EFMP. Finally, your MPF certainly is the one who's going to do any travel orders, out processing, those types of things. Your school liaison is a great person to connect with prior to your next PCS to make sure that you know about the school districts and the new area you're going. They can really help guide you there. And of course, when special education needs are not being met by your school district, your special education legal assistance team at your JA, Judge Advocate Office, is the person you want to contact. And my last thing is I definitely want you to have the ways to communicate with us. So not only through the forum, right, but certainly we are out on Facebook. We'd love for you to follow us there. All of our updates are always out there on Facebook. So by all means, we'd love to have you there. That also provides you an opportunity to direct message us through Facebook. We'd love to hear from you there. And then, of course, DAF Family Vector is there and has some really, really good information. The Total Force Service Center, always here for families. And if you're an EFMP family, you have your own option on the main tree, and that is option 8. And they can help you or warm hand you off to us if there is something you need right away. So again, we look forward to talking with you. I'm going to turn it back over to Mr. Rubin, and we'll open up the breakout sessions.